It is my pleasure. My name is Rebecca Kozak. I will be your host for the next 2 hours with this program of Ask Doc Live. And I am here joined by my co-hosts, John T. McCollier, Ruth Ellen Sanchez, and Nasima Omar. And of course, the amazing Dr. Joel Wallach. So before we get started, we got to just read this wonderful little disclaimer to let you know that the content of this program is not meant to take the place of your primary care physician. It is for nutritional education only. The FDA requires us to let you know that our products are not meant to treat, prevent, diagnose, or cure any diseases. But when you give the body what it needs, your body can do some amazing things. And the testimonials that you will hear on this program are testimonials using the products that Dr. Wallach has recommended for the individual, which he'll be recommending for you as well. So be an empowered individual. You don't have to rely on a system that is managing health and keeping you sick and on pharmaceuticals. We have the father, the co-father of epigenetics, where he has proven through research and through clinical putting his research to action that there are no genetic diseases. You've got genetic, you've got not genetic, you've got nutritional deficiencies starting from the womb. And without further ado, it again is my honor to be able to provide this resource to you and this amazing individual, Dr. Joel Wallach. Dr. Wallach,
Good morning, Rebecca. Good morning,
welcome.
team. Thank you. Okay, we have some good news and some sad news this morning. Let's go with the sad news first. India reported their highest rate of new infections in one day, 314,835. And they're running about 200,000 infections per day, and they hit that spike in the last 24 hours at 314,835. The biggest spike they've had is 9 million new cases in one day. Remember, they're the second largest population on Earth, so 1.4 billion people, second only to the Chinese. And they had the greatest rate of death, the highest rate of death during the Spanish flu in 1918, where they had 20 million people die in 6 months. They had 110 million people infected in that same 6 months. And the Indians are very interesting. They have a split population. They have 29 states. I spent a lot of time on the UN and the World Health Organization websites and stuff figuring this out. They have 29 states and 7 territories. The northern 9 states are totally different than the southern 20 states and the 7 territories. Now, they're all homogenous people. They're all the same people. Okay, they don't have 16 different races and people from different origins and things are all the same. So that's helpful. But the northern 9 states, they live on wheat, barley, rye, and oats, and they have 95% of the deaths and 86% of the infections. The southern 20 states and 7 territories, they live on maize, corn, rice, sweet potatoes, beans, squash, and algae, and they only have 5% of the deaths and only 14% of the infections. Okay, what's the difference? Well, that gluten from the northern states kills their intestines. They don't get the algae, so they're not getting any mineral supplementation for their bone marrows to make white blood cells, red blood cells, platelets, and antibodies. And so even since 1918, the northern 9 states of India have been hit many times harder than the southern 20 states and 7 territories. But there is a reason for that. It's their diet. It's their diet. Now, the good news is we know what's going on. We know, in fact, let me give you our figures for the USA. This is as of this morning. We have 32,671,025 infections. 32,671,025 infections. As of this morning, in India, they have, remember, they have 1.4 billion people. We're 1/5 of their population. They have 16 million infections and 184,000 dead. They have half the infections we have and about 1/3 of the deaths we have. Okay. And so that's because we primarily live on gluten, wheat, brown, rye, and oats, oatmeal, the breakfast of champions, Wheaties, cream of wheat, pancakes, waffles, bread, spaghetti, let's see here, pizza crusts that are made from wheat, bagels, matzahs. Everything we eat is wheat. Everything we drink. And when you look at Michigan, which has the highest rate of daily infections, a little state in the Midwest, they have, they average between 5.5 and 6,000 and 5.5 and 6,000 new infections every day. What is going on there? Well, that's because they have the highest rate of home microbreweries. They're all making beer and drinking their beer made from wheat. Okay, so I figured that out. So we got to change all this. Okay, now remember, there's another piece here. We're not only responsible for ourselves and our neighbors, but we're also responsible for any future babies we have. And during wars and during pandemics, there's always a spike in babies being born with birth defects because everybody eats crazy, drinks, and doesn't supplement and so forth. So I urge everybody to remember, as Rebecca said, myself, along with Bruce Lipton, we're considered the fathers of the science of epigenetics. I have a great best-selling book, Epigenetics: The Death of the Genetic Theory of Disease Transmission. It goes along with 2 CDs by the same title, Epigenetics: The Death of the Genetic Theory of Disease Transmission. And it goes into all the birth defects. Okay, with the exception of some infections, like the pandemic and other infections early in pregnancy where the embryo is damaged by the virus, and also maybe some poisons where people are drinking during pregnancy and they get, fetal alcohol syndrome and that kind of stuff. With the exception of those things, all birth defects are caused by nutritional deficiencies in the first 90 days of pregnancy. Prenatal vitamins say you're supposed to take them before pregnancy, pre-pregnancy, prenatal, okay? And most women do not take prenatal vitamins until they've missed 2 periods and they go to the drugstore and they get one of those home tests and they pee on it and sure enough, they're pregnant. Well, they've been doing all the bad stuff for the first 2 months of pregnancy and they have a high probability of having a baby with a problem. Okay, well, it gets worse during wars and pandemics and stuff like that because people are just doing crazy things and not thinking about tomorrow. So I want you to remember, if you're in the childbearing years and you're sexually active, or even if you're not sexually active and you're in the childbearing years, after Friday night on alcohol and everything, and you think the world's coming to an end tomorrow, anything can happen on Friday night. And so you need to be getting rid of the bad foods so you can maximize absorption, no fried foods, no processed meats, no oils, no gluten, no wheat, brown, rye, and oats, no sugar. Okay, all that's got to go. And then you need to take the 90 essential nutrients. Remember, all birth defects are caused by nutritional deficiencies. And we're talking about, some really weird stuff here. Let's look at some of these birth defects. Down syndrome is caused by deficiency early in pregnancy. I've been able to reverse them before the end of the 3rd month of pregnancy by giving them other heavy-duty vitamins and minerals. And they were diagnosed with the 3-screen test and the ultrasound. I mean, I've seen the ultrasounds. We're talking about Lauren Knievel, Evel Knievel, the Daredevil's niece-in-law. And she had a very severely affected embryo, Down syndrome. And I sent her overnight. They held the brain and heart pack. This is like 25 years ago. And she started taking it dutifully and staying away from all the bad stuff. And the baby, Noah Knievel, was born perfectly normal. Freaked everybody out, including the doctors, because they're looking at those 3-screen tests and the ultrasound. They say, this can't be, maybe we got it wrong. Let's check this kid again. Is this DNA? Is this really your kid? And so forth, because they couldn't believe it wasn't a Down syndrome baby. And then we're talking about sickle cell anemia. That's not a genetic thing. Sickle cell anemia occurs in everybody. It's not just in Black folks, but in white folks and Asians and Latinos, they call it what? What?
Tell me, Doc, because I just I knew that in my brain and I went to say it. I'm like, no, that's not right.
Okay, I'll give it to you in a second. Okay, it's caused by a nutritional deficiency early in pregnancy. Okay, and the babies are born with sickle cells, but they can't call it sickle cells because they're not Black. It's supposed to be a genetic disease of Black folks. But it's a nutritional deficiency early in pregnancy, okay? And they they don't pass it on. You can get two people with the sickle cell anemia, whether they're white or black or red or yellow, doesn't matter. And they can have 10 babies and none of them will have sickle cell anemia if the mother's taking the 90 essential nutrients before pregnancy starts. Okay, because it's not a genetic disease. Okay, the same thing is true with, let's see here. Let's look at, let's look at gender issues. Okay, everybody freaks out over this gender stuff. And they're talking about people who are bisexual, who are asexual, who are transgender, and all that kind of stuff. And everybody wants to say, this is my choice. No, they're kind of driven that way because it's caused by an underdevelopment of the hypothalamus, which is the part of the brain that tells you who to chase for sex. It doesn't matter what equipment you have between your legs, whether you're a boy or a girl, or you have both or whatever, it doesn't matter. You're going to chase who your brain tells you to chase. And if your hypothalamus is underdeveloped, you get a problem. Just like cerebral palsy. Cerebral palsy, doctors say, oh yeah, you have an autoimmune disease, baby's born, with, no ability to walk properly and everything like that, cerebral palsy. But what happened was the baby didn't get enough nutrition when the brain was developing. And it was the cerebellum, which controls your balance and your ability to exercise and move and everything, was underdeveloped. Let's see here, I'm having noise here in the background. Okay, so at any rate, all these things are totally 100% preventable. So they got to take the 90 essential nutrients, stay away from the bad foods, and they will avoid having babies 9 months from now or a year from now with all these terrible diseases. Just remember, there's always a spike during wars and pandemics and all this kind of stuff. And so I urge you to really, really take your 90 essential nutrients, really, really, really stay away from the bad stuff, and we will come out of this in good shape. So with that, then I also want people to take care of themselves. They need to take our hand sanitizer. It comes in these little 2-ounce bottles. I have a little cart by the door, which all the teenagers just left, okay, through the door. And so I put we have the pint pump bottles. I put that on the cart, but I take these little 2-ounce things with me in my pocket or my briefcase, and as our hand sanitizer. I also have one of our bottles of colloidal silver. I take 2 droppers full of this at a half hour before each meal and a half hour before bedtime. We've been doing that for 25 years, Rebecca. The colloidal silver kills every virus and bug and fungus and bacteria you can think of. I mean, we're talking about HIV, AIDS. We're talking about the Spanish flu. We're talking about COVID-2, COVID-19. We're talking about polio. We're talking about all these diseases, okay, syphilis. This kills them all, okay? And so why not take it as a preventative? So I've been doing it as a preventative for 25 years. And so it just really works for me because I deal with so many people and who knows what they got, what they don't got, right? So I just take that. And then also for energy during the day, I take our Rebound, our sports drink with 100 nutrients in it. We have Red Bull and Gatorade, which has a couple of nutrients and mostly sugar and caffeine. This has 100 nutrients in it, and it has the nutrition in it. It has the special nutrients in there to prevent that heart death that kills these young athletes. Now, there was just a 19-year-old basketball player who had just signed an NBA contract after he graduated college. He was 19 years old. He signs a contract, he's going home, and he dies of this heart attack. I guarantee you he was drinking one of these energy drinks with no nutrition in it. He wasn't drinking our Rebound, okay? What a terrible, tragic story, okay? I'm sure his family is like, what? This great young athlete, how could he die of a heart attack? Well, he died of a heart attack because this is what's called hypertrophic cardiomyopathy heart disease, a sudden heart death in young athletes. Right now in America, this year so far, we're not even halfway through the year. We've already got 500,000 young people under the age of 30 who've died of hypertrophic cardiomyopathy heart attack. Dr. Milan and I did 1,700 autopsies on kids in China in Heilongjiang province, Qishan University in 1988, because we knew that nutritional deficiency, caused by nutritional deficiency, caused these other diseases. So we found in 1,700, we found 35% had cystic fibrosis, supposed to be the classic genetically transmitted birth defect. And then 100% had muscular dystrophy, and 200 of them under the age of 1 year of age would have been diagnosed with Sennett syndrome here in the States. So we got it all written up and published in 3 languages. In 1990, the English version is the Biology of Trace Element Research, 1990. Please get that and read it, and you will be flabbergasted at all these birth defects that are preventable. We gave that to Jerry Lewis in 2011 after we kept treating literally hundreds of people in Utah and Idaho with muscular dystrophy. They have one of the highest rates of muscular dystrophy in the USA that they had. And so we figured out, we started giving them these nutrients, and even ones that are 31 years old and they were born with muscular dystrophy and they're 31 years old and really ready to die, and we give them our stuff and it all goes away. Okay, because it's a nutritional deficiency. It's not a genetically transmitted birth defect. Well, to make a long story short, a year and a half after April 16, 2013, when we won a federal case with that study, 1,700 autopsies on these kids under the age of 10, they couldn't resist 1,700 autopsy data. So the federal judges ruled that all the baby formulas, Enfamil, Similac, and all the rest of them had to put this one nutrient in the baby formulas, which they did. A year and a half later, okay, we're talking September 13th, 2014, the big newspaper in Charlotte, North Carolina, the Charlotte Observer, came out and said, front page, like Third World War. I mean, we're talking about big, bold letter headlines. We don't know why, but Sennett syndrome has vanished in the state of North Carolina. 3 months later, St. Louis Post-Dispatch, all the newspapers in Missouri came out and said, we don't know why, but Sennett syndrome has vanished in the state of Missouri. Then 3 months later, every newspaper in the world came out and said, we don't know why, but the diagnoses of Sennett syndrome diagnoses has dropped dramatically by 85 to 95% all over the world. And the rate of death from Sennett syndrome went from 1 in 300 to 1 in 3,000, okay, because they put that nutrient in there. Now, here we come. This is very simple. This is very simple. This is not difficult. Why do we not have health insurance for farm animals? We don't need it because we give them vitamins and minerals. Okay, farmers would not pay a veterinarian to come out there every day and treat their hogs and their beef animals and their sheep and their chickens and their turkeys and their pigs and so forth. They would just kill them and eat them. Okay, they would not be giving long-term maintenance and management treatments. Well, health insurance was one of the biggest negatives for human health in America, because it gives doctors permission to manage your disease and charge your insurance over and over and over and over and milk you like a milk machine, like a milk cow, because they don't feel guilty because it's not coming out of your pocket. Insurance is paying, but you're still suffering. Okay, when you can get rid of the disease in 30 days, type 2 diabetes is not a genetic disease. You can get rid of it in 30 to 60 days. It's a simple nutritional deficiency disease. I don't care if you've had it for 30 years. Okay, so wake up, get with us, and we'll walk you through this. This is not difficult. Okay, over to you, Rebecca.
So no, it's not difficult at all. And Dr. Wallach, I've actually experienced, not my personal self, but somebody I know that was told that they were going to have a Down syndrome baby, and we got them on a nutritional program, and she's beautiful, bouncing little girl with absolutely no signs, evidence, nothing.
Well, if I may, just 1 minute here, let me interrupt you there. We have a young couple who were Down syndrome babies, and their parents, they didn't know each other, but they gave their kids our products from the time they were like 8 years old. They got married. Let's see, it's Ben and Wendy Erdman, okay, from Dallas, Texas. You probably heard of them. And he got a job. He went to school at Texas A&M, got a degree in engineering, and they had him teaching electrical engineering in Texas A&M. He just retired, 6 months ago after 20 years of teaching. Here's a Down syndrome couple. They're beautiful. And when you look at them, you're really hard pressed to tell they're Down syndrome because they've been on our products for 40 years. And so even late, you can still do benefit for people with Down syndrome by getting on the products and getting them off the bad foods.
Well, and so we're kind of moving away from Downs on this one, but I have a business builder that I'm working with, and she has a son. She put her son on the products 4 years ago, and he was high functioning autistic, but could not function in a classroom. And now Dr. Wallach, he's taking full load classes at a college and doing fabulously.
Isn't that beautiful?
It's wonderful. I mean, she was like, she knew there was something out there, and she kept searching and searching. And when she heard you on the radio, she had some hope. She gave us a call. I was fortunate to be, the one that took the call, and I know Ruth Ellen has worked with her as well, and it's just been something that is life changing for their whole family. So
Oh, there
it's
you go.
incredible. Absolutely incredible. I love it. I love stories like that, and we hear them all the time.
Yeah, well, we
Well,
get them by the thousands every day. Okay, remember, we're in 50 countries. We may be more than that now. I have to check, but as of a year ago, we're in 50 countries. I think we're probably closer to 55, 57 countries now. So I'll have to get the data. But we're all over the world. We see 2 million people a day. Now, I want you to remember, Rebecca, that in the Old Testament, there were 83 miracles. Okay, I checked that out. In the New Testament, there's 80 miracles. We create 2 million miracles every day because of the information. We have an army of people. Back in the Bible days, they didn't have electronics. They didn't have telephones. They didn't have emails and all that kind of stuff. You had the angels and the apostles walking from one village to the next and talking to 3 people. And I'm sure there were more miracles, but they didn't get recorded because everything was so remote and there's no way to record it and pass it around the world overnight. But now we get a miracle, like we get somebody who hadn't urinated for 10 years, and we get them on our program, and in 2 weeks' time they're urinating, and they get them off of dialysis in a couple of weeks, and they've been on dialysis for 25 years. Okay, and so these are the sort of miracles we do every day. And of course, we put it on the internet and so forth. Bam, the world knows about it. So we're seeing 2 million miracles a day, and so that's why we're working hard on a book coming out. Actually, I have 2 books coming out, and one of them is so crazy it's scary. Okay, because it goes back to the beginning when in Genesis in the Old Testament it says, in the beginning, God created the heavens and the earth. But it doesn't say, did it take him 5 minutes, 15 minutes, a half hour, 3 days, 6 weeks, a million years? It doesn't say. Then it goes into the rest of the story. And so I went back and found out, when the universe was created. And so we got that. This is all going to be in the beginning of this book. And we're going to give God all the credit, but we're going to fill in that, he jumped from, or whoever wrote the Bible, jumped from God created the heavens and the earth, which is true. But then how long did it take before the Garden of Eden came along? Well, I have all the dates and everything because they've dated the Garden of Eden. They've dated when Adam was created and so forth. So this goes along with all the dates of everything else I know. And it's all going to be put in the proper order. It's going to be a freaky, freaky, freaky book.
Oh, Dr. Wallach, it definitely sounds like it's going to be an interesting, a must read.
Be a must read book.
Yeah. So speaking of your books, Dr. Wallach, I just want to let everybody know that you can find Dr. Wallach's most popular books on our website at askdoclive.com. So you can go to the website, find that there. And also all of the products that Dr. Wallach is going to be mentioning today in the protocols as we're getting to all these hands, this is absolutely fabulous, are on that website as well under our store, plus the replay of this program. So again, if somebody sent you here to watch this program, get back with them. But if not, you can feel free to use that store to get the products that you need as well. Now, if you have specific questions that you would like to have answers to, we do have a team of certified holistic health coaches that are available to answer your questions via email on that website. There's a contact us. You can send us an email and we will have somebody get in touch with you. For those of you, again, who were not sent here by somebody specific, we also have a call team that will be standing by at 855-949-7234. We do have a team that is there waiting to take your call. So Dr. Wallach, we have a ton of hands up already. So
All
let's
right.
go ahead and get started. Let's go with Judy, who has her hand up. Judy, go ahead and unmute yourself. You are on live with Dr. Wallach.
Hello,
Try
Judy.
one more time. Okay, she's not getting unmuted, so let's go ahead and move to the next hand, and that is Mary. Hello, Mary. I know you're waiting. Go ahead and unmute yourself, Mary. Uh-oh. It's not you, Doc. Hold on. Oh, Judy's unmuted. Let's go to Judy real quick.
Okay.
Hi, I'm Judy. I am 64. I have really bad osteoporosis, and I'm 110 pounds.
Okay. Judy, do you have any other issues? Do you have anything like high blood pressure, diabetes, thyroid issues, anything like that?
No, I'm really good. I'm really good with that stuff.
Okay. Do you have any ringing in the ears, any tinnitus, ringing in the ears, or balance problems?
Balance. I'm going blind, and I'm almost blind, so I think the balance might go with that possibly.
Okay. Well, you have osteoporosis of the skull. You have what's called ONA, optic nerve atrophy. And I've won so many bets. I've won so many bottles of wine and big dinners at Ruth Chris's Steakhouse because doctors have lost bets with me. I take people who are blind 6, 8, 10, 12 years. They think it's macular degeneration, which is a kind of degenerative disease of the lining of the eye, of the retina of the eye. But really what's happening is when you have osteoporosis of the skull, the tunnels that the 12 pairs of cranial nerves come through and that the spinal cord goes through get filled up, and they're like 50% of the size they're supposed to be, and they squeeze the nerves. When you have ONA, optic nerve atrophy, the skull is squeezing the optic nerve, slowly squeezing the optic nerve, and you slowly lose your vision, okay? And it also squeezes the artery going to the back of the eye. It also squeezes the veins coming back from the eye. It's all kinds of weird things can happen. There's like 10 different diseases you can get when you have osteoporosis of the skull that affect the optic nerve. So you have osteoporosis of the skull that causes the dizziness, the balance problems, also the gradual blindness. The doctors always get it wrong. I will say that again, they always get it wrong because when they look in the eye, they don't see a cataract. They don't see they test the pressure and there's no pressure in there, so they don't have glaucoma, so they just blame it on macular degeneration. And they don't know what else to do, but it's actually ONA. I want you to get a hold of the book called It's All in Your Head. Goes into the 25 different diseases you get when you have osteoporosis of the skull. How come it is medical doctors don't tell people about osteoporosis in the skull? It's not just osteoporosis in your leg bones, and your pelvis, and your vertebrae. You also get osteoporosis of the skull, and there's 25 different diseases you get to, and you go to all these specialists and they milk your insurance policy. So I want you to get a hold of that book. It's All in Your Head. And then I want you to get rid of all the bad foods so you can maximize absorption. Absolutely no fried foods, no processed meats, no oils, no glutens, no wheat, butter, rye, oats, no sugar. Okay. Then I want you to take at 110 pounds. I want you to take 1 healthy brain and heart pack per month, but I also want you to get another bottle of arselenium, not from Walgreens, but arselenium. It has 5 cofactors in there you need. And so I want you to take 3 of those twice a day because 1 comes with the healthy brain and heart pack. Then I want you to get 1 bottle of MSM, so you can take 3 of those twice a day, and they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes your bone itself, which includes not only the bone in the skull, but also the bone marrow, which produces your white blood cells and your antibodies and your red blood cells and platelets, which is your immune system. And in this pandemic time, that's very important. Okay. I also want you to take our vitamin D3, take 3 of those twice a day. That's 2 bottles a month. It'll help you absorb the minerals, particularly calcium, and put that into the proper places in all your bones. And then I want you to also take our glucogel, take 110 pounds. I go ahead and take 3 or 4 or 5 of those twice a day. That's 2 bottles a month of our glucogel. I also want you to get our Fucoid Z, which supports your immune system, but also it supports your bone marrow cavity, the 9 algae and seaweeds that are in the Fucoid Z actually support your bone marrow, which is very important when you have an osteoporosis, because the bone marrow cavity fills up with scar tissue and fat. Okay, it's called bone marrow dysplasia. Okay, and that's why people get prescriptions of iron and B12 pills, and that don't work because they're villi or dead because they're eating gluten. So they come in once a month to get shots of B12 and iron. People don't like that, and then doctors want to do a bone marrow transplant, which is no, it doesn't hurt the patient financially because insurance will pay the $100,000. Okay, but there's a risk, and of course that's not the answer to the problem. So do these things. Call us every 2 weeks. Let us know what's going on because you're going to get your vision back.
Oh, wow.
Okay.
Thank
And
you.
so you bet. And also you're going to increase your immune system so you can fend off, the bad guys. Okay.
Thank you very much. I appreciate it.
Okay. We look forward to hearing from you, Judy. God bless.
Okay. Thank
Awesome. Thank you, Judy. And again, you can find the replay of what Dr. Wallach recommended for you at AskDocLive.com. Let's move on to Mary. Mary, go ahead and unmute yourself again. You are on live with Dr. Wallach.
Hi, Mary.
Hi there. Did it work?
Yes, ma'am.
You're on.
First of all, I got to say I want to thank you for paying for the shipping for my products. I get them all the time.
Oh, yeah. You're on auto ship, so I pay the shipping.
Yep. I appreciate it. And I probably don't need to tell you anything because the lady before me is what I needed, except I weigh more than her.
How much do you weigh?
I weigh 130 and I'm 5 foot tall and I'm 88.
Okay. Now I know you have certain problems because you have gray hair. Do you have any varicose veins in your legs?
Oh, yes.
Okay. Now,
Yes.
well, varicose veins and gray hair are caused by the same nutritional deficiency. Gray hair is not due to age. It's a nutritional. I've seen 12-year-old kids like Michael Jackson, the famous black singer. He had white hair, had vitiligo over his whole body. He lost his skin pigment. He died at 51 of a ruptured aortic aneurysm, which is also caused by that same deficiency. So I need to make sure. I want you to at least take one healthy brain and heart pack per month at 130 pounds. I want you to get an extra bottle of R-selenium with all the cofactors in there, and your hair color will come back and the varicose veins will go away. Okay, because these are caused by nutritional deficiencies, not by aging. Okay, and then let's see here. Do you have any skin problems, any eczema, dermatitis, or psoriasis?
No.
Okay, all right. So you don't have any other issues? So let's go.
May I ask you, I don't like to talk bad about our products, but I cannot take the ultimate EFA. I had a reaction to it.
Okay, now is that the dark ones or the clear ones?
The dark ones.
Okay.
The ultimate.
Okay, the Ultimate Classic?
Yes.
Okay, you're talking about the
No,
tablets.
the EFA.
Okay, Ultimate EFAs. Okay.
Yeah.
Okay.
Mhm.
And okay, so you're talking about the dark ones. Well, this is the essential fatty acids from seeds. The
Right.
EFA pluses, they're in the amber clear ones. Are you able to take those?
I think so. Yes.
Okay, good.
I
Well, they
went
come
to-
from
I went
fish
to the
oil.
vegetable ones. I went to the vegetable one, EFA.
Okay.
Well,
Yeah, well, we have two
I'm
of them.
happy.
And you're happy. It doesn't matter which one you get them for.
No,
We have two different sources for just that sort of information. So no,
Good.
that's why we have the source from fish and we have the source from seeds. So you choose yours. I take 3 of each of them
Sure.
twice a day.
Good.
Okay, well, thank you so much, Mary. Keep us informed. But I want to
Oh.
see you every couple of weeks because I want people to see that you're, within 6 months, you're going to have, I don't know what your original hair color was, blonde, red, black, brown, whatever it was.
Black.
Okay, well, let's keep looking for black
Okay.
hair.
Yeah.
Okay.
Well, I'm already getting it, so yeah.
Okay.
Thank you very much, Doctor.
Okay, bye-bye.
Bye-bye.
All right. Awesome. Well, Dr. Wallach, people say you have too many products, but this is exactly why we have the products that we have so that things can be tailored directly and specifically for the individual. So that's something I love about us.
Yeah, well, we have products for over 600 different diseases. We have 5,000 products. Okay. Now, probably, I would say a good couple hundred of them are skin care and beauty products and, laundry detergent and stuff like that. But other than that couple hundred, the rest of them are all nutrition. Okay. So we have 4,000, about 850 nutritional products. And remember, there's 600 different diseases we deal with. And so you have to have all this stuff in various combinations and strengths. And because you have babies, they need liquids, okay, like kids' toddy. And then you have athletes, they want the big hammer. Of course, we have the plague right now, so we have to have the big hammer. And plague was the word they used for pandemics back in the Bible days. And why they changed it to pandemic, I don't know. But a pandemic is a plague. A plague is a pandemic. It's kind of funny.
I guess pandemic is just not as ugly of a sounding word as plague. I don't know, but it's just not, it's not good. And the nice thing about it though, folks, is we can protect ourselves. We may get something that is part of the plague, but we can fight, we can overcome, and we can come out stronger and more vibrant than we were when going into it. So keep that in mind. We are empowered. We do not have to be a victim to anything. Now, Dr. Wallach, my first question that was sent to me this week, she said, your skin is so pretty. Did you ever have skin issues? And yes, I did. I had very dry skin. I had rosacea. I had, my feet were cracking. My fingers were cracking all around my fingernails. My skin, well, rosacea, so it was always red. And that was the first time I saw you, Dr. Wallach.
Mm-hmm.
You had mentioned, I had stood up and started telling you some of the problems that I was having. He says, you have a gluten intolerance. And one of the first things I said was, okay. And you said, I can tell because because your skin is so red and you've got rosacea. And I said, well, I've got a sunburn. I'm always sunburned. He said, you said, no, you have a gluten intolerance. You have rosacea. I cut gluten out, Dr. Wallach. And my skin, you can tell right now, yeah, I haven't been sunburnt in a long time.
Well, your skin is beautiful.
Sunburn. But she goes on and she says, I was diagnosed with rosacea and high blood pressure. My doctor said my rosacea will not go away unless I use this antibiotic cream, and I refuse. But my skin gets really red and it seems to be getting worse. I have removed gluten from my diet, and I need to know what nutritional products can I take to help get rid of the rosacea and get rid of high blood pressure.
Okay. Well, here what we need to do. She needs to get rid of gluten, but also she cannot be cooking for anybody else, cooking pancakes and spaghetti and waffles and things for other people. She cannot work in a bakery. She cannot work as a waitress, any of those kind of things where gluten's involved in delivering bread to people's tables and all that kind of stuff. She's got to be her environment. Everybody who comes to her house, if they eat gluten, they got to strip in the front yard and she's got to hose them down before she lets them in the house. Okay, no gluten. Then per 100 pounds of body weight, she needs to take one healthy brain and heart pack per month, the big hammer in the toolbox, because she's been on a gluten issue for a long time. And so she's got a lot of problems going on here, and she could just be walking down the street and drop dead from a ruptured aneurysm. So she really needs to get on this. Then one healthy brain and heart pack per 100 pounds of body weight. If she weighs less than 130 pounds, I want her to get another bottle of our selenium, so she could take 3 of those twice a day, because one bottle comes with the healthy brain and heart pack. Yeah. Okay. And so her skin will get better. The rosacea goes away. This is a classic nutritional deficiency disease caused by deficiency of a big clumsy molecule. And it's one of the first things that people see when they get long-term gluten issues, because they can't absorb that nutrient. And so they always see like psoriatic arthritis, they get psoriasis, they get rosacea, they get celiac disease in their intestines, all that kind of stuff from gluten. Okay. And because they then have all this damage in their intestines, they can't absorb other nutrients. And so they wind up having immune deficiency. They say, oh, you have an autoimmune deficiency. Okay, you have lupus, which is an autoimmune disease. Your body's attacking itself. No. And they have this advertisement on TV. I don't know if you've ever seen it. They show this big stream of eosinophils, the white blood cells that deal with inflammatory things and allergies. And so they get this big stream of eosinophils going into this intestine. They say, you have celiac disease and the eosinophils are destroying your intestines. No, they're in the intestines because they're trying to relieve the inflammation because of gluten. They've missed it by 1,000 miles and they've let them get on TV with this crazy 180-degree wrong information. And I don't know who to choke first. Okay. That's a TV advertisement I see 4 times a day now on TV for this drug. It's actually a cortisone or prednisone or something like that. It says, now, one of the side effects of this drug is you can get cancer and you can get other diseases which will kill you, but you won't die from celiac disease. Why would you take a drug where the side effect is death? That doesn't sound good to me.
No, it doesn't. And since we're talking about that, folks, I really encourage you to read that insert that comes with your pharmaceuticals. So your doctor's not going to tell you the bad stuff. It's just the good stuff that he's been told. But read that insert. It blows me away. The people that we have come on and they have all of these joint pains and body pains and blood pressure issues, and they're on a pharmaceutical where those are the first things that are the side effects. It's like, okay, let's take another approach. That's not going to give you those side effects, at least not negative side effects. I love my side effects, Dr. Wallach. I mean, I can run up and down stairs. I can go outside, not worry about, anything. Falling. I used to fall up and down stairs because my knees were so bad and my migraines were so bad. So I love the side effects of not having any of those negative health issues. It's fabulous.
Yeah, you can use that extra time to deal with life.
I can enjoy life, Dr. Wallach.
Yeah,
Not
there you
deal
go.
with it. I can enjoy it. And I do. I very much do enjoy life. Let's go to our next hand up, and it's my buddy Lance. Lance, go ahead and unmute yourself. You are on live with Dr. Wallach.
Hi, good morning.
Good morning.
Thank you. I want to thank you so much for all the work you do. I think it's pretty amazing. This country spends a ridiculous amount of money on healthcare. And so I think the work you do is just amazing.
Well, you're very kind. Thank you.
But I have a client who, her name is Brenda. Now she's been diagnosed with lupus and she's 235 pounds, 5'6", 70 years old. Now she has, her only symptoms are basically she gets a sharp pain in the back of her neck and her left foot is swollen. And
now, does she have that rosacea, that red mask on her face kind of thing, rosacea of her face?
No, her skin is good. She doesn't have any skin issues, and she has no tendonitis, and her eyesight is fairly good. And but she does have gray hair and spider veins and swelling in her left foot.
Okay. Does she have any bowel problems? Any constipation, diarrhea, celiac disease, irritable bowel syndrome?
Only bloating.
Okay.
Yeah.
Okay. So she never complains about irregular heart rate or anything like that?
Yes, she does have an irregular heartbeat.
Okay. So she's got AFib, atrial fibrillation. Okay. She's got osteoporosis of the skull. Okay. Okay. So she's getting those kind of nerves squeezed. Okay. So that'll affect all kinds of things. Tinnitus, ringing in the ears, balance issues. She can begin to slowly lose her vision as the optic nerve gets squeezed, get ONA, optic nerve atrophy, because the skull is squeezing that. Ringing in the ears, balance problems, irregular heart rate, bloating and stomach issues is called gastroparesis. It's caused by the skull squeezing the 10th cranial nerve. That's that same nerve that actually causes the irregular heart rate. And every once in a while, there's a branch of that 10th cranial nerve called the recurrent nerve. When that gets squeezed, when that branch gets squeezed, you get hiccups. And people say, I don't know why, I just get hiccups for 10, 15 minutes, 2 or 3 times a day. And so that's because that 10th cranial nerve is being squeezed. Okay, so here we go.
Now,
She
the
weighs
doctor,
Oh.
excuse me, Dr. Wallach,
Mhm.
but the doctors are telling him that she has real low white blood count.
Yeah, because she has her bone marrow is dead.
I see. Okay. Right, that makes sense. Yeah.
Okay, she got osteoporosis. Her bone marrow cavity, she has dysplasia. Okay, it's all scar tissue and fat, and she's not making many white blood cells. Okay, and that's why they think she's got an autoimmune disease and all that stuff. No, she's got osteoporosis, and wherever that osteoporosis goes, there will be a dramatic effect, which she's showing. Okay, she got atrial fibrillation, she's got a regular heart rate, and doctors think she's got a heart problem. No, it's her skull squeezing the 10th cranial nerve. She got bloating. Does she have ulcers or that kind of stuff? No. She's got gastroparesis. Again, that's caused by squeezing the 10th cranial nerve. And then she's got varicose veins and white hair. This is all caused by deficiency of a single nutrient, which causes a breakdown of cartilage, ligaments, tendons, connective tissue, artery walls, vein walls. And so when there's so many things going on there and the doctors don't know what to call it, they say, oh, you have an autoimmune disease, you have lupus, blah, 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 blah. Well, here we go. 5'6". I want to see a lady may weigh 140 pounds. So she needs to lose about 90 to 100 pounds. I want her to start off with one of her 3 meals a day. Just start off with 1 meal a day of our keto caramel meal. It could be the bar or the shake. Just start out with 1 meal a day. And after a month or so, and she's comfortable with how that works, she can try, say, 2 or 3 or 4 days a week, not all week, but 2 or 3 or 4 days a week, go for 2 meals a day. Okay. The rest of her meals, she needs to eat like an Asian: corn, maize, rice, sweet potatoes, beans, squash, excuse me, and seaweed, which we'll get to in a minute. Then I want her to take 2 healthy brain and heart packs per month. 2 healthy brain and heart pack per month. That's our biggest hammer in the toolbox. I want her to take 2 full doses twice a day of the healthy brain and heart pack of everything in that box. And then I want her to also get 2 bottles a month of our MSM, so you can take 3 with each meal. And they're designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Bone makes your bone itself. And at various different rates of speed, all of her problems will go away. Okay. She also needs our vitamin D3. She can take 3 of those twice a day. That's 2 bottles a month. She could take our, let's see here, collagen or glucogel. I want her to take 5 of those twice a day. It's 2 bottles a month. I also want her to take either our Pro Joint FX at noontime, take 3 of those capsules then, or she could take our collagen peptides at noontime, one or the other. And then I also want her to take 3 of our Fucoid Z capsules 3 times a day. That's our algae, our main algae product. Has 9 different seaweeds and algae in it, has all the trace minerals from the ocean. And if she wants, I do this, I also take the ocean's gold. So I take 3 of each twice a day, and it gives you all these weird trace minerals from the ocean. It makes your bone marrow happy so you can make white blood cells. Okay. Again, even if you only have a modest amount of bone marrow left, but the bone marrow will regrow and repopulate as long as she's getting off of the wheat, butter, rye, and oats so she can absorb the nutrients. And it's an amazing miracle. And so again, I see probably 2 million miracles a day throughout the world. And this is just an expression of what people used to see 2,000 years ago during Bible days. They were on a bad diet. And one of these angels or one of these followers, of Moses or Jesus or whoever they were following, they'd say, well, eat this way. And all of these religions came up with diets, okay, which helped a lot of people. You think about that, okay? This religion has this diet, this religion has this diet, this religion has this diet. And even the people in California, the Seventh-day Adventists, they have their diet, right? And so when you have all these various religious groups, they usually start because they have a large number of people in their community who have certain problems or combinations of problems, and they find out a diet that works, and they start spreading that diet, and they create a religion. It's kind of crazy, but you see the same scenario over and over and over and over. I don't know how many, there's, I think, 12 major religions around the world, and every one of them has a different diet. So there you go.
Okay, great. Thank you so much. I really appreciate
Yeah,
that.
it'll give us an update every couple of weeks, because she's going to show benefit very quickly if she does everything we say.
Okay, I certainly will.
Okay,
Absolutely.
thank you, sir.
Okay, thank you.
Bye-bye.
Have a great day.
Wonderful. Thank you so much. Lots of great information shared there, folks. So I hope you're paying attention. Now, Dr. Wallach, I have a question that has come in that has to do with scar tissue. This individual was in a car accident years ago, and they thought that they had a food blockage, and it turned out to be scar tissue that had built up in the intestines from the accident. What can be done to help them with that?
Okay, well, they can blame it on the accident, but maybe it's gluten.
Maybe?
Remember, in the old days, everybody knew that the plagues were due to evil spirits. They knew it. So what this person needs to do is get rid of all the bad foods. You know, do the things you can do. No fried foods, no processed meats, no oils, no glutens, no wheat, rye, and oats, no wheat, rye, and oats, no wheat, rye, and oats. There are no such things as gluten-free oats. The gluten in oats is called gliadin, and a copper-jacketed bullet will kill you just as well as just a lead bullet. Okay, so don't think you can eat gluten-free oats, because there is no such things. There are no such things as gluten-free oats. No sugar. And then one healthy brain and heart pack per 100 pounds of body weight. I also want them to take the Fucoid Z, anti-inflammatory, support the immune system, support the bone marrow cavity, okay, and support repair. Okay, so you take 3 of those Fucoid Z capsules twice a day, 2 bottles a month. And I would also take our digestive enzymes, our ultimate enzymes. Go ahead and take 2 or 3 of those, say 10, 15 minutes for each meal, a couple ounces of water. And then, contact us, email us, or call us every couple of weeks and let us know what goes on. Because I think even if the scar tissue in the intestines is due to an accident, I think getting on a gluten-free diet and taking the 90 cents of nutrients is going to give this individual benefit.
All right. Thank you so much, Dr. Wallach. Let's go to the next hand up, and we have Abbas. Go ahead and unmute yourself.
I'm sorry, was that Abba?
Yeah, it's Abbas.
Abbas.
Yeah. Hi, how are you, Doc?
Okay, how can we help you?
Actually, I'm 128 pound, 5'6", 64 and a half to be exact, my age. I'm on, like, I have my thyroid problem like 10 years ago.
Okay, stop. Where are you from? Where are you from, Abba?
I'm from Toronto.
You're a Canadian?
Yeah.
How come you have an accent?
Yeah, because I'm originally from Middle East, from Baghdad, Iraq.
Well, cool. That's what I was asking. Okay.
Oh, sorry. Yeah. I thought you said from your calling. Yeah.
Yeah. Okay. So you have white hair. Do you have any varicose veins in your legs?
No.
Okay. Spider veins in your legs?
No.
Do you have bowel problems, constipation, diarrhea?
No.
Okay. Do you have high blood pressure, diabetes?
It's good. Like I start my diet like years ago, and it's good. The only thing I have my thyroid, so I have thyroxine 0.075 milligram. And 6 months ago, I had my heart beat something, so my physician transferred me to the specialist, to cardiologist. She put me 2 days on Holter and echo, and she said, "You're fine. You just, when you get excited, your heartbeat got like 140, something like that."
Okay, let me ask you, do you have any ringing in your ears, any tinnitus or ringing in the ears? You know, kind of like
yes, noise? I have buzz in my ears. Yes.
Okay, you have bugs in your ears. Okay. Do you have any dizziness or balance issues?
No.
Okay.
I have crackling in my knees though.
Okay, you have joint problems.
No,
okay.
No pain, just crackling.
I didn't say pain.
Oh, yeah.
You have noise. Okay, you have noise. Okay.
Yeah.
So yeah, when you have crunching, you might not have pain, but you do have stuff going on in there. Your cartilage is going away. All right. When you have this heart issue, is it in regular beat or a fast rate, or what happens when you have the heart issue?
Actually, just like the heartbeat got fast when I get excited. Like, for example, I used to solve the Sudoku thing. Like when I start solving it, I feel my heartbeat goes up.
Okay. Yeah, well, my heartbeat used to go up when I'd see pretty girls when I was a teenager.
Me,
Okay, so at any rate, yeah, you have osteoporosis. You have osteoporosis of the skull, which can be squeezing the 10th cranial nerve, which can cause this sudden heart rate change. Okay, it's not a heart issue. It's osteoporosis of the skull squeezing the 10th cranial nerve, the vagus nerve. Okay, and then the tinnitus ringing in the ears is a squeezing of the auditory branch of the 8th cranial nerve by osteoporosis of the skull. Do you ever get any tingling or numbness or pain in your fingers or wrists or anything like that?
no, just cold. Sometimes it's cold, like my hand, my fingers.
Okay. Okay. So here we go. Yeah, you have osteoporosis, including the skull. I want you to get a hold of that book. It's all in your head. There's 25 different diseases you get. You've got like 4 or 5 of them, of these 25 diseases, because of osteoporosis of the skull. But you have osteoporosis elsewhere because your knees crunch and pop. So what I want you to do is get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, brown rhinos, no sugar. I want you to, excuse me, I want you to take 1 healthy brain and heart pack per month. I want you to get another bottle of selenium. We have 1 bottle of selenium in the healthy brain and heart pack, but I want you to get another bottle of our selenium, not from Walgreens, but ours with the 5 cofactors. And your hair color will come back because the hair color has nothing to do with age. It has to do with a nutritional deficiency, okay, which is going to kill you with a ruptured aneurysm if you don't deal with it, okay? So I want you to get another bottle of our selenium so you can take 3 of those twice a day. I want you to get 1 bottle a month of the MSM, so you can take 3 of those twice a day, and they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone mixture, bone itself, including the bone marrow cavity, and which is important now during this pandemic, so you can make antibodies and white blood cells, red blood cells, and platelets. Then I want you to take our collagen, our glucogel, get 2 bottles a month. So you can take 5 of those capsules twice a day. You can either take the Pro Joint FX at noontime, 3 of those, or you can take the collagen peptides at noontime. And for drinking, okay, we have great coffee. We have our Javalution coffees, and we fertilize all those plants in the plantations where we grow in Nicaragua. We own the plantations. We use our Bloomin' Minerals, so the coffee has minerals in it. But we also have a water coming from Iceland. You know what's going on in Iceland right now? They had the first volcanic eruption they've had in 800 years there. And we get our water from the Icelandic water, which has all these minerals from underneath the land because of these volcanic eruptions. Well, this is going to give us a whole new supply of fresh minerals. Okay, so I make my powdered drinks into liquid by putting them into the Icelandic water, which is one of our products. And so you're getting the extra minerals in the water. So we're really excited about that. So call us every couple of weeks because you're going to have a great story, Abba. You're going to have a great story. And yeah, you will help a lot of people with your testimony. So I look forward to hearing you in 2 weeks and 4 weeks and 6 weeks, please.
Thank you. Thank you so much, Doctor.
You bet.
Awesome. Thank you, Abbas. We appreciate you coming and joining us today. Now, Dr. Wallach, I don't know how many emails and texts that I get through the week. I'm going to have to start counting them. But it's in regards to the prostate, having prostate issues.
Well, you don't have to worry about that.
I don't. There's so many men out there that do. And because I care about more than just myself, Dr. Wallach, I want to know why is prostate issues such a problem? I mean, we've got elevated PSAs, we've got cancer. What can be done to, one, prevent for those who don't have prostate issues yet? Because they don't have to get them.
Okay.
And what can we do to address them?
Okay, well, all tissue in the body, including the prostate and the ovaries and testicles and, all these things require 90 essential nutrients. They all have the ability to make new cells, repair themselves, because, none of these cells live forever. They live for 30 days, 60 days, 90 days, 2 years, whatever it is, and they die. You got to be replaced by other cells. One of the reasons why people get told they have a prostate issue, or they make that, they surmise that themselves, is that they have to urinate like every 10 minutes or something like that. Oh my God, my prostate thing is going crazy. Well, they could have a low back problem, and they're squeezing the nerves to go to the prostate. And so the prostate is getting the signal from the squeezed nerve saying pee, 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 because that nerve is being squeezed. Just like when you get hammer toes, you get burning and itching and all that kind of weird stuff going on in your feet and toes and ankles and legs. It's a back problem. It's called sciatica. It's a peripheral neuropathy. So I'd probably say 90% of the time, the issues with the prostate gland are a back problem. Okay. And then as long as they don't have cancer, this is what I would suggest. Well, let's go for everything, even if they have cancer, prostate cancer, that's been diagnosed by biopsy. They have to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, bran, rye oats, no sugar. You've never heard that before, but everybody needs to do that, whether you have a prostate gland or not. Then they need to get on one healthy brain and heart pack per month per 100 pounds of body weight. They need to take the MSM, one of those, one bottle a month per 100 pounds of body weight, 3 of those twice a day, and they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Well, how does that help the prostate? Well, again, if your discs are shrinking, your vertebrae getting closer together, smashing those sciatic nerves, which some actually support the prostate gland, tell the prostate gland what to do. They get a squeeze, they tell the prostate gland pee, pee, pee kind of stuff. And so, or don't pee, and then they have to catheterize them, put a permanent catheter in. So they're just dribbling urine all day into a bag. And so that could be a back problem, not really a prostate problem. So that's why I do the bone and cartilage and ligament thing with that scenario. And then if there's no cancer there, I want to do 2 things. Number one, they need to take, they need to eat 3 eggs twice a day with soft yolks, not hard boiled, that won't work. But you have to appreciate that testosterone, like estrogen, is 95% by weight cholesterol. So they need 3 eggs with soft yolks, soft boiled, soft poached, soft scrambled butter twice a day. And that's going to give them the cholesterol to make testosterone. Also, they need Zeratest for the prostate. Take 3 of those twice a day, as 2 bottles a month. That's going to give the Sertoli cells in the testicle what they need to make testosterone, along with the eggs. And the testosterone drives the prostate function. And then we have what we call ProstFX. It has a bunch of herbs and nutrients in there that are specifically designed for prostate health and support and function. And I take 3 of those twice a day. On ProstFX, I take 3 of those twice a day. I'm 82 years old and I don't have any problems in that area whatsoever. Okay, and so this is prostate responds very quickly when you deal with all these issues. If you just take the ProstFX, you say, well, I took it for 3 months and nothing happened. Well, it was a back problem. Okay, so that's why I say do all this stuff and you're going to benefit all over. Just like when you had like 20 different problems and they're all gone because you dealt with it by doing everything I told you. You didn't just take one product. And so, yeah, you got to do the whole recipe to get the right cake.
Well, and I didn't just do it for a couple days either, Dr. Wallach.
Are you still doing it?
I'm still doing it.
How long have you been doing it now?
5 years now.
All right. Congratulations.
5 years.
I've been doing it for 73 years.
Yeah, you've been doing it a few more years than I.
73 years, yeah.
I do have one question, because you had mentioned if they don't have cancer, they can take the Zeratest. What would you add if cancer has been shown in a biopsy?
Okay, I would add more of our selenium. I'd have them take 3 selenium 3 times a day instead of twice a day. Okay, if they have prostate cancer. And I would also take some of the other products that support the immune system. Again, more Fucoid Z. Take 3 of those minimum, 3 twice a day. I do that. I take the Ocean's Gold, 3 of those twice a day. But I also take the Cell Shield RTQ. I take 3 of those twice a day. It supports the immune system and is anti-inflammatory. I also take the, let's see here, Killer Biotic, which deals with infections, but also deals with bad stuff going on, anti-inflammatory. And so I take Killer Biotic. I take 3 of those twice a day. And I take the Colloidal Silver. Colloidal Silver supports your immune system. 2 droppers full under the tongue, half hour before each meal, 2 droppers full under the tongue, half hour before bed. Been doing that for 25 years. It kills all bad stuff.
All right. Excellent. Excellent. Thank you so much. I mean, my email right now no joke, Dr. Wallach has at least 200 questions in regards to
Wow.
prostate. So that right there will be able to help me answer a lot of questions. Thank you so much. Let's go to the next hand that is up, and that is Rob. Rob, go ahead and unmute yourself.
Hello.
You are on live with Dr. Wallach, Rob.
Hello. Thank you. I'm 67, white male, 216 pounds. I'm having pressure. Back in December, I was having really high blood pressure. Went and saw my heart doctor. It took him 3 months to get me on the cath lab table. My blood pressure went into the emergency room, 205 over 110. Okay. And this has been going on for a couple of months. They put me on the cath table. In 10 minutes, they said, we already know what your problem is, but we can't fix it. You have a stent in your left coronary artery and it's 100% blocked. I said, well, then how am I living? They said, your body created a new pathway for your blood to go to your body. So they said, you only have 2 options here, take medicine or crack the chest and do a bypass. So I'm doing the medicine. They got me on 10 milligrams of amlodipine, AMLODIPINE, 50 milligrams of hydrazine, HYDRALAZINE, 100 milligrams of lorcatin, 50 milligrams of metropol. My blood pressure is now normal, but
With medication.
I am very big on taking vitamins. I take them every single day. I take multiple vitamins. You have any ideals for me?
Vitamins will not help you with your heart problem.
Okay, well, I try to stay healthy, so what can you tell me, or how can you
Okay,
help me?
I can tell you by looking at your hair. Do you have varicose veins in your legs?
No, sir.
Do you have spider veins in your legs?
No, sir. In fact, 3 years ago, when I went on Social Security, I went to my doctor and I lost 30. I joined a weight loss group called TOPS, taking off pounds centrally. I lost 30 pounds the first year, 30 pounds the second year. And so I started at 265. I got down to 190. I've gained some of my weight back. But
excuse me, that's because you haven't resolved your basic problem.
okay.
And okay. Do you have any skin problems, any eczema, dermatitis, or rosacea?
No, sir.
Okay. Do you have any bowel problems, any constipation, diarrhea, irritable bowel syndrome?
No, sir. But 6 years ago, I did have colon cancer. I had a tumor, and it did not get into my lymph nodes, so I had it cut out. And it's been over 5 years, and I'm cancer free. Okay,
good. Congratulations. Yeah, I'd be very interested to see the slides. You know, I want to see the slides under the microscope myself because I don't know about the diagnoses. Okay. So at any rate, what I want you to do here, and you'll change because you'll see your hair color will come back. I want you to get rid of all the bad foods. Now, you may have done some of this, but we got this, millions of listeners here, so they have to hear this too.
Okay.
I need you to get rid of all the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat bran oats, no sugar. Okay. The only good oil is the oil you put in your car. No oils, no olive oil, no extra virgin olive oil that will give you cancer.
Okay.
Okay. Then absolutely, I want you to, at 216 pounds, I want you to take 2 healthy brain and heart packs per month, a full dose, everything twice a day, 2 healthy brain and heart packs per month. I want you to take 2 bottles a month of our MSM, so you can take 3 of those with each meal. They're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes your bone itself, which is important for the bone marrow as well as the cartilage in the joints and that kind of stuff. I also want you, because of this blocked coronary artery, I want you to take, in the high blood pressure, I want you to, even though you're being medicated, I want you to be able to wean off the medication, okay, like Rebecca did. I want you to get on 3 bottles a month of our Ultimate Daily Classic tablets. Take 3 of those, 3 with each meal, 3 with each meal. That's 3 bottles a month of the Ultimate Daily Classic tablets. And it's going to support healthy blood pressure and also support healthy blood flow through even blocked arteries. Now, you got to do the diet also, as we just said. Now, what I want you to do is appreciate you're not going to cold turkey off of your blood pressure medication. What you're going to do is, take your blood pressure on a regular basis. And as you see your blood pressure kind of coming down a little bit, you can begin to decrease your blood pressure medication based on the numbers. Just don't, oh, I'm starting Wallach's thing, I'll just dump all my drugs. Don't do that. Okay. And then I also want you to take our Z radical capsules. I want you to take 3 of those three times a day. That's 3 at breakfast, 3 at lunch, 3 at dinner time. That's Z radical. That's our 9 algae and seaweeds capsules. And they give you weird trace minerals for your bone marrow. That's going to help you with defending yourself. And of course, at your age, 67 years old, with high blood pressure and all this other stuff going on, this means that you're at risk of having a very bad outcome if you get the COVID. So you really want to watch that, whether you're vaccinated or not, doesn't matter. Okay. So give us a call every couple of weeks, give us an update. If nothing's happening, tell us nothing's happening. But if you say, I'm not sure, but my blood pressure may have dropped a couple of points here. And I'm going to want you to turn your head for me every time you come on so I can see, yeah, I can see your hair color. Okay. And I can see it in your beard and your mustache and all that kind of stuff. Okay. So thank you, Rob. And we look forward to hearing from you soon.
Thank you, sir.
Awesome. Thank you so much, Rob. And everybody, I apologize. I went right through our break. We were just on a roll. So Dr. Wallach, let's take a 5-minute break and we will be right back.
Michelle Swindell, you don't have a microphone that we can see. So if you can turn your microphone on so that we can talk to you when we come back from the break, that would be super awesome. Thank you.
Yes, thank you, Ruth Ellen. So if you aren't able to find that microphone, if you click on the microphone, it'll give you the option to use device audio. You want to make sure you click on that. Thank you. All right, thank you and welcome back everybody to Ask Doc Live. Just a reminder that this program is brought to you by AskDocLive.com as a resource for alternative options to addressing health, keeping healthy, and also addressing health concerns. Get with the person that invited you to this program. If nobody invited you to this program, then please feel free to go to our website. We have a store there that offers all of the products that Dr. Wallach is mentioning. We also have a contact us that if you have specific health concerns and you want to know what's going to be best for you, you can send us an email. We have a team of certified holistic health coaches standing by to help you get on the right track and a better journey to health. We also have a call team that is on standby at 855-949-7234. They are here to help anyone who has never spoken to anybody that's involved with longevity before and have never tried the product. So they're here to answer some questions for you too. Now, Dr. Wallach, are you ready to get started again? I saw you here. Where'd you go? There you are.
The mute thing popped on, so I had to unmute myself.
Yes, yes. Well, the walking across the floor and everything going on, we want to try to eliminate that sometimes during break.
Thank you.
You're welcome. So let's go to our next hand up, Dr. Wallach. Michelle. Michelle is busy at work, but taking time to join us to ask her questions, Dr. Wallach. So Michelle, go ahead. You are on live with Dr. Wallach.
Hi. Uh-oh.
Uh-oh. Okay, so we can't hear you. The microphone is connected, but the volume on it on your side might be down. So look into that and we'll go to the next hand. And that is John. John, go ahead and unmute yourself. You are on live with Dr. Wallach.
Hi, can you hear me?
Yes,
Yes.
sir, we can.
Hi, Doc. So
Yes, sir.
I was on with you about 3 weeks ago, and I just got all my supplements. I'm in Canada and things were a bit slow getting here. So I just got the last of it on Wednesday. So I'm starting the program. I've been following staying gluten off all the gluten products for probably 6 weeks now. So my first question is about the vaccine, the COVID vaccine.
Mhm.
Do you recommend getting it?
Okay, well, here's the deal. Stop there with that question.
Yep.
Everybody's got to make their own decision whether or not they're going to get the vaccine or not. If you're
Right.
going to get the vaccine, you want it to work, right? You know, if
Yep.
you want to maximize the benefit of a vaccine, you got to get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, butter, and oats,
Mhm.
so that you can maximize absorption of the nutrients necessary for your body to respond. Vaccines do not kill viruses, bacteria, fungus, or yeast. Vaccines only alert your body to the bad DNA and RNA in the bugs. So when the bug appears, your body says, uh-oh, here's a bad guy. We've been alerted to this. And so your bone marrow is supposed to release white blood cells, T lymphocytes, that kind of thing, antibodies, red blood cells, platelets to go kill and eat the virus. Okay.
Right.
Now, you're responsible for two things in addition to getting the vaccination, if you're going to get the vaccination. Vaccination of itself will not work. That's why people say, well, you know, my mom had, you know, the 2 vaccine thing, and 3 months later she died of the COVID. How'd that happen? She had her 2 vaccinations. Well, what'd she eat for breakfast every morning? Well, she had oatmeal for breakfast every morning for 70 years. Well, that's why she died. Okay, because her intestines were dead. Those villi in her intestines went away. And even if she was supplementing, she couldn't absorb the nutrients. But if she's eating gluten and not supplementing, her intestines are dead. The nutrients necessary for the bone marrow to respond to the vaccine never got there. So
Right.
there's these 3 pieces. You got to be able to absorb. You got to get the nutrition in you through the intestinal wall to the bone marrow. And then your bone marrow's got to be making all the defensive systems to respond to the vaccine. Everybody says, well, I've got the vaccine. I'm good to go. I can do whatever I want. No, that's just like 10% of it. The vaccine is just 10% of it.
I
So I
agree.
hope that answers the question.
Yes. Now, it's not here yet, but it sounds like we may be required to get the vaccine, whether we want to or not, because I know some people that their workplace won't allow them to go. So,
Well, then you have a choice. You can not get the vaccine, lose your job, or get the vaccine, keep your job. I mean, that's your choice.
that's correct. So if let's just say I decided I wanted to get it, do you believe one is better than the other? Because some are mRNA, some are not mRNA.
Well, we'll find out. We'll find out in 10 years which is better. But they've all been
okay.
created using previously agreed upon technology.
Right. Okay.
None of these are experimental.
Okay. So I'll go on to my other questions. So I'm just starting the program. I would sort of like to get a blood test sort of as a marker where I am right now. Does that make sense to you to go and do that?
Okay, I don't mind you getting a blood test, but a blood test is only good for 0.3 of a millisecond. What happens 30 seconds later is totally different, right?
Okay.
Because the blood is something that's changing every second.
Okay.
And so I want you to get a hair analysis.
Okay.
You know, from the nape of your neck. You can get the book, Rare Herbs and Cures, go to chapter 9 and 10, tells you how to collect the hair, how to package it up, where to ship it. Don't forget to put the check in with it because it won't run the test without the check. And you'll get 2 charts. One chart is going to go through all the essential minerals, and you'll get a graph with all these bars showing you where they're at. Are they low? Are they in the middle where they should be? Or are they some too high? And there's all kinds of scenarios we can talk about. We don't have time right now.
Yeah.
Then also there's a second chart which goes into the toxic metals, lead, things like lead, mercury, uranium, and all these other weird toxic minerals that come from factories and sprays and all kinds of stuff like that. And so I do one of those hair analysis once a year just to mark what's going on, what's changed in the last year. So I've been doing that, gosh, for 20 years, blood samples, or not, excuse me, not blood samples, hair analyses once a year. And so I have a pretty good idea. I've been gluten-free for 73 years. I've been taking 90 essential nutrients for 73 years. So I'm 82 years old and I'm in pretty good shape. I don't have any of the pre-existing conditions. I have none of them. No blood pressure issues, no diabetes, no arthritis, no irritable bowel syndrome, no thyroid issues, no heart issues, no lung issues. I don't have any of that stuff. Okay, because I've been doing all the right things for 73 years.
Right. Okay. So, in general, I weigh 216. I'm 63 years old. We've determined I've got osteoporosis of the skull, and that I have erectile dysfunction. So you gave me all my supplements to take, but there's a few other things that are going on in my body. One of them is I get athlete's foot occasionally, and right now I have jock itch. So my doctors told me to take a topical cream, but it doesn't seem to be doing the job.
Okay. Okay. So here's what I want you to do. Are you taking your 2 Healthy Brain and Heart packs?
I just
per
started.
month?
Yes.
Okay. Okay. Yeah. Because again, we need to give stuff to your bone marrow, because your bone marrow has got to participate in all this with the white blood cells to go kill your jock itch bugs and your athlete's foot bugs.
Okay.
It comes from your bone marrow.
So it's all
And so
internal. There's nothing topical that can be done.
Well, yes. Our
Okay.
colloidal silver.
Yeah.
Okay. There's no alcohol in it. It won't burn. You
Okay.
can put it in baby's eyes. It doesn't burn. And
Okay.
so, but it will kill every kind of bug you can think of, viruses, fungus, yeast, bacteria.
Even topically. Okay.
Yeah. And
I
so
have a
I take orally two droppers full, 30 minutes for each meal, and 2 droppers full, 30 minutes for bedtime. Been doing that for 25 years.
Okay.
And that's one of the reasons why I don't get infectious disease. I don't get the flu and the colds, and because
Okay.
I have radio 24/7 for 30
Yeah.
years, so I can't afford to be sick. So I've been sticking with my colloidal silver.
Okay. So I have a bottle of that. So I am taking it internally, but you're saying I can use it topically also?
Yeah, you can put it on a cotton ball and put it between your toes where you have the athlete's foot, and it'll kill the bugs. But also, by getting rid of the bad stuff and taking your your vitamins and minerals, your bone marrow is going to send the white blood cells internally to kill the athlete's foot bugs and jock itch bugs also.
Okay. All right. And what will the I guess it's fungus, right? Athlete's foot and jock itch. Will it stay inside shoes, and will you get it back in the future?
Well, these things live in the environment. There's thousands of bugs live around you all the time.
Okay.
Okay. And they're there, and they'll jump on you if they find a weak spot. And so
Okay.
it's your job to not let there be weak spots.
Okay. I'll let somebody else get on. I thank you very much for your.
Okay.
God
Well,
bless
thank you. But yeah, let's hear from you on a regular basis, because your story will help a lot of people. Thank you, sir.
Awesome. Great. Thank you so much for those questions, John. Thank you very much. Let's go ahead and try Michelle again. Michelle, go ahead and try unmuting yourself. Let's see if your microphone got connected.
Nope.
I don't see that it's connected yet. Yeah, I don't hear any sound.
I
Sorry,
see her
Michelle.
lips moving.
You wanna
I see her
type
lips
your
moving,
question?
but I don't hear
Yeah.
any noise.
So if you want
Let's
to type
go
your
on.
question, Michelle, we'll get your question answered. Let's
Okay,
go
let's go on.
to Jesse.
Thanks, Rebecca,
Welcome.
and good morning, Dr. Wallach.
Good morning. How can we help you, sir?
Good to hear from you. So I had a 2-part question. One on behalf of my wife, who's 19 weeks pregnant. The other is for my aunt, who was just diagnosed with AFib and also tachycardia, fluctuating/low blood pressure. So I'll start.
Okay, I'm hearing music or something in the background.
Oh, so sorry about that. Sorry about that. 1 second.
There you
Okay.
go. That's better. Thank you.
All right.
Okay. Okay. First of all, your wife is 9 weeks pregnant, you said?
Yes, she's 30 years old, 165 pounds, 5'8".
Okay. Now, was she taking vitamins and minerals before she got pregnant?
Yes, she was.
Okay, good. Okay. Now, does she have any clinical symptoms she's worried about, or does she just want to know?
She's been on the Healthy Brain and Heart Pack, and everything's been fine. But in the last 2 weeks, she's been getting migraines. So I wanted to ask you about preventing migraines during pregnancy.
Okay, well, migraines can be due to osteoporosis of the skull. Okay, so make sure at 168 pounds, she needs to be taking 2 healthy brain and heart packs a month. She's not only eating for 2, but she's eating and supplementing for 2, right? So she needs 2 healthy brain and heart packs per month. Is she going to breastfeed this baby or?
Yes, she is.
Okay, good. Yeah, so she needs 2 healthy brain and heart packs per month, full dose everything twice a day. And then I want her also to take the vitamin D3. She can take 3 of those twice a day, particularly up in Canada, right? Here in Canada, is that correct?
No, I'm actually in Texas, Austin, Texas.
In Texas, okay. Austin, Texas, okay. Yeah, so she still needs 3 of those vitamin D3 capsules twice a day, and she needs to continue taking those. And because when you have these sort of things, it's usually due to either a vascular problem or a bone problem. The vascular problem, and she's how many weeks pregnant now? 9 weeks pregnant?
She's 19 weeks.
19 weeks. Oh, okay. Okay, so she's past the first trimester.
Yes.
Yes, okay. So yeah, so she can also take the Fucoid Z. She can take 3 of those twice a day. That's anti-inflammatory. Plus it gives her some weird trace minerals that support the bone marrow and all that kind of stuff. It wouldn't hurt for her also to get 2 bottles a month of the Ultimate Daily Classic tablets. Ultimate Daily Classic tablets. And take 2 with each meal. So there's not a big spike twice a day. She can have 2 with each meal. That's 6 a day. 2 bottles of the Ultimate Daily Classic tablets. And that's going to support healthy blood flow through even blocked arteries in the brain, the uterus, and every place else.
Okay, and if she's on the tangy tangerine already, would you add that on top of it? Okay.
Yeah, well, there's just 2 totally different issues here. One is for getting more blood supply to the brain, okay, and the kidneys, blood supply to the brain and the kidneys. And the other one is just a great multivitamin mineral supplement that covers all bases. And so when you have a clinical thing going on, that means for some reason there's something missing someplace. Okay, so you got to add something, which we call a secret sauce from the side.
Right.
Okay, and then let's see here. The second one was the AFib. Who's that? Your aunt or?
Yes, my auntie. So she is 55 years old, 160 pounds, and also 5'8". And she was just diagnosed with AFib and also tachycardia, if I'm saying that right.
Yeah, tachy. Yeah.
Tachycardia.
Yeah. Tachycardia means fast. AFib means your heart rate is going fast, and slow, really weird. Okay, this is all caused by osteoporosis of the skull, squeezing the 10th cranial nerve. Okay, so she's getting rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, bread, rhinos, no sugar. Then I want her to have 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, a full dose, everything twice a day. I also want her to get 2 bottles a month of our MSM, so she can take 3 with each meal. That's going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone, rich bone itself, including the skull. Okay, and AFib is not a heart problem. It's a symptom. Have you ever heard of peripheral neuropathies?
Yes.
You ever heard of sciatica?
Yes.
Okay, what causes the pain and numbness and burning in the feet and hammered toes and all that kind of stuff? Is it going on? It's a peripheral neuropathy. It's your back. Okay, it's a squeezing of the sciatic nerves in the back. So if you just treat, put something on your feet to stop the pain, is it helping really?
No.
Okay, no. Well, the same thing here. They want to anesthetize her, open up her chest, and do an ablation is what they treat AFib with in humans, and they kill more people than they help. Okay, by trying to kill the heart muscle. Okay, and so really, let's treat her osteoporosis of the skull, and the AFib just goes away. Okay.
And then one follow-up, in terms of taking a calcium supplement, I was wondering, is there a calcium supplement you'd recommend other than the OsteoFX, just without sugar? Or sugar
well, I think most of them have some kind of sweetener in them because calcium tends to be dry and, not too appetizing. But myself, I use Cal Toddy because it has the minerals in it as well, Cal Toddy. And so I use the Cal Toddy and I put a tablespoon, a half ounce of that in my liquid drinks, in the morning for my BTT 2.0. Also in the evening, I take another tablespoon in my liquid of the Cal Toddy. And that way I get more calcium and, I don't have osteoporosis of the skull, even though I'm 82 years old. And it wouldn't hurt for her to get a couple of these books. It's all in your head, one for herself and one for her doctor.
Yep, I already have it written down.
Okay, and if she is in the longevity business, or you're in the longevity business, the cost of that book will be tax deductible as a something as you're doing to build your business.
Okay, that sounds great.
Okay.
All right, thanks so much.
Okay, thank you, sir. Bye-bye.
All right, awesome, and congratulations again, Jesse. So I just want to do a real quick recap, Dr. Wallach, and I was going to do it earlier, but I think this is a more appropriate time.
Okay.
So we're looking at things that are spine related. You've got your discs that are compressing, and all of these things like optic nerve atrophy, migraines, eye issues,
Prostate.
issues, prostate issues, sciatic, the
Gut,
peripheral neuropathy.
stomach issues.
Stomach, that's another one, the gastric.
Yeah, gastroparesis. Yep.
It's like all of these things, Dr. Wallach, are because we're decompressing. The body's not getting the nutrients that it needs to stay active and keep those discs where they're supposed to be. So it's so important, folks, that we need to not ignore these symptoms, because it's like you get one symptom and another one and another one, another one. And the simple thing is it's all related to the same thing.
That's correct. And of course, when you look at the people who live the longest up in the Hunza Valley, okay, between Pakistan and China, their average lifespan is 165. Their oldest one, documented, actually agreed upon, nobody doubts it, was 265 years of age. Okay, Dr. Lee Chin Yun, okay, he's kind of, in modern times, in the Bible, people lived to be 800 years of age, 700 years of age, 969, Methuselah, okay? And these people all lived in the Middle East and where these people lived the longest, okay? And that's because, and even then they were using wood ashes, which had minerals in it, into their garden, and putting wood ashes in their stew and their soup and that kind of stuff as a source of minerals. And when we went to electricity, we gave up the wood ashes, and doctors said, don't waste your money on vitamins and minerals, just eat well, you get everything you need. And so nobody replaced the wood ashes when it went away, when we went to electricity. And so even though you think you're using grandma's famous recipe for her stew, you're not getting the same recipe she had because she was putting wood ashes in it.
Yeah, there was wood ash going into a lot of things other than just physically putting wood ash. All those vegetables grown in rich soil.
Yep.
I remember Dr. Wallach 30 years, well, it wasn't 30 years ago, but when I was 30 and going through the different people in the Bible and how old they were, I was at that state where I am so thankful we don't live that long, because I hurt too bad. And now I'm looking forward to 120. So
well, that's minimum.
love it.
120 is minimum.
Minimum.
Okay.
So
Minimum.
when I hit 120, you've got to be around, Doc.
Yeah. Okay. Well, I will be. I'll be
Awesome.
150. I'll be 150 when you're 120.
Awesome. All right. Next, let's go to Jolynn. Jolynn has a great question. Go ahead and unmute yourself, Jolynn.
Gotcha.
Got it. You're on live with Dr. Wallach.
Hi.
Hi.
I'm so happy to meet you after all these years. Okay.
Well, thank you. Thank you for calling.
At first, I talked to you about I had neuropathy from chemotherapy. It's getting a little better, but I did get on your 90 essentials, glucosamine, MSM, and D3. I noticed a difference the first week. It was unbelievable. So now my problem is, though, living in certain areas, I suffer from barometric pressure headaches. I did this when I was a kid. It's when I lived in the desert for 30 years, never had it. It's all related to environment of whatever happens.
When you live up in Denver now?
No. I'm in Riverside, California, which has no
okay.
air in the world. Yeah. And it comes on right before a storm is going to happen. It's some kind of an electrical thing that happens. Like I said, I had it when I was a kid. And my mother says, why are you dressing so warm tomorrow? Because I always put my clothes out the night before school. And I says, well, it's going to rain. She says, well, how do you know that? I says, because I have a headache. That stayed with me all my life until I was in the desert. Never had it. Is there anything we can do for that?
Yes. Okay. Well, first of all, do you have varicose veins in your legs or spider veins in your legs?
Yeah, one or two.
Okay. Now, the reason I know that is you have white hair.
Yeah. I have that.
That's not due to age. How old were you when you started getting white hair?
About 45.
Okay.
I was a hairdresser for many, many years. And I also told my customers, take vitamins and your hair color come back. It does to a point. It doesn't come exactly back to what you have.
Well, there's specific nutrients you need to take. Okay.
Oh, okay.
There's very specific nutrients that are involved in hair color and the elastic fibers in the walls of veins and arteries and skin and that kind of stuff. Okay. So I want you, how much do you weigh, Jolene?
132 right now.
Okay. And what's your age?
73.
All right. All right. Any other issues? High blood pressure, diabetes?
No.
Okay.
It's not the opposite, low blood pressure.
Okay. Do you have anything going on with anything like fatty liver?
No, I do the Hulda Clark's gallbladder liver flush. Unbelievable what comes out in the colon. I could not believe it.
Okay.
After doing that, I had a colonoscopy. Let me tell you, the doctor said, he said, I have never seen such a clean colon as you at any age. And he said, it's all pink. And I thought, wow, Dr. Wallach's got to hear this.
Thank you for the feedback.
Yeah.
Okay. Now, also, do you have anything going on with your skin? Any eczema, dermatitis, psoriasis, or rosacea?
No, I've always had acne, blackheads, overactive oil glands when I was younger. And I have scars from all that.
Okay. What about any tinnitus, any ringing in the ears or balance problems?
Vertigo I have suffered from. I've been in the hospital because of that.
Okay. Have you lost your sense of smell or taste?
No, that's very good.
Are you slowly losing your vision where you need to change your eyeglasses prescription regularly?
No, because I just had a check and he said, your prescription is better now than the last prescription. In other words, your eyes are getting better.
Good. Okay, good.
Yeah.
Excellent. Okay. So, you ever get hiccups?
Not often. No.
Okay. All right. So here we go. I want you to get rid of all the bad foods. And again, this is for the rest of our listeners also, right? So no bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat bread, no sugar. And then at 132 pounds, I want you to have one healthy brain and heart pack per month. Get another bottle of R-selenium, not Walgreens selenium, but R-selenium. It's got the 5 cofactors in it. One of those cofactors is what's missing, causing you to have the white hair. Okay. And I get nervous about that because people die of ruptured aneurysms when they have white hair and varicose veins and all that kind of stuff. So I want you to get another bottle of R-selenium, not Walgreens selenium, R-selenium. So you can take 3 twice a day. 1 bottle comes with the Healthy Brain and Heart Pack. I want you to get 1 bottle of our MSM. So you can take 3 of those twice a day.
I'm doing that.
Okay, good. I want you to take 3 of our vitamin D3 capsules twice a day. There's 2 bottles a month. I want you to take our glucogel, take 3 or 4 or 5 of those twice a day. But I also want you to throw in the middle of the day, either Pro Joint FX, 3 of those, or our collagen peptides in the middle of the day. A dose of that's a powder, 1 scoop in your drink or applesauce or something.
What
and
was
then
the first one? The first one you said?
Is it Pro Joint FX?
Joint.
Pro Joint FX.
Pro Joint X. Okay.
Pro Joint FX.
FX. Okay.
Yep. Okay. Then I also want you to take our Fucoid Z, which is going to support your bone marrow. At your age, you're at that point now, if you get hit with the bug, with the pandemic virus, if everything's not perfect, at your age, you have these pre-existing conditions, including age, your bone marrow isn't perfect. And so I want your bone marrow perfect. So I want you to get the 2 bottles a month of the Fucoid Z capsules. You can take 3 of those twice a day. If you prefer the liquid, you can get a quart per month of the Z Radical. Same thing, just tastes good. Kids like it. You can take a tablespoon, which is a 1/2 ounce twice a day of the Z Radical, are 3 of the capsules twice a day. There's 2 bottles a month of the capsules. I travel a lot, so I take the capsules because I can't take the quarts. They're too heavy on the airplanes and stuff like that.
Yeah.
Okay, so there you go. And so that's where I would go with this. And
I want to do a hair analysis. What book was that in?
Rare Earths Forbidden Cures.
Rare Earth and Forbidden Cures.
That's
All right.
correct. Okay. And yeah, I'd like to know what your hair analysis says.
Okay.
And then, and then don't forget, our colloidal silvers.
Yeah, I want to get on that. I'm doing a very high 3,000 a day vitamin C, a good brand, but I'd rather go that way if that's even better.
Okay, well, vitamin C supports your immune system. This kills the bug with a shot to the head.
Okay.
This kills the bug. It's totally different than vitamin C.
I think I like that.
So you can do both. I do both. I take, our chewable vitamin C. I take 2 of those a day. 2 of those a day, 1 with breakfast, 1 with dinner time. But I also take my colloidal silver 4 times a day, 2 droppers full under the tongue half hour before each meal, and 2 droppers full under the tongue half hour before bed. Been doing that for 25 years. Okay. All right. Well, thank you, Jolyn.
Well, about the barometric pressure, do you think all this would help that also? Or?
Yes. Oh, yeah. Yeah. You're going to see benefit there. Absolutely.
Okay. That was my main concern. Thank you so much.
I don't remember because we've been going back and forth here and all over the place. Did I say Ultimate Daily Classic tablets? Yeah, 3 of those twice a day. Ultimate Daily Classic tablets, 3 of those twice a day. They will support healthy blood pressure and healthy blood flow through blocked arteries in your eyes, your brain, your heart, your legs, every place, your kidneys. Okay.
Okay. Thank you so much.
Okay. Bye-bye.
Bye-bye.
All right. Awesome, Jolyn. Thank you for coming on with us. And just a reminder, all of the products that Dr. Wallach is mentioning today are found at AskDocLive.com in our store. And Dr. Wallach, you're also taking the Beyond Tangy Tangerine every day.
Oh, yeah.
Which is a great dose of vitamin C. So we don't want to forget that vitamin C as well. I have a question here from Jennifer, Dr. Wallach. Her son has ASD, ADD, HD, and is heterozygous for MTHFR.
Okay, there's too many abbreviations here.
Attention deficit hyperactivity disorder. Okay. And ASD, if I remember right, is on autistic spectrum. I might be wrong.
Mm-hmm. Okay,
And
how old
then-
is this kid?
Does not say.
Is he
But
3,
yes, autism
15?
spectrum disorder. We'll see if she comes on.
Okay. Okay. Well, yeah.
But
Well,
anyway,
this is okay. Go ahead.
With the MTHFR, with it being a mutated gene, they have a hard time with processing like folate and B12 unless it's methylated.
Now, have you ever
excited
heard of the
about-
science? Have you ever heard of the science of crapola?
Well, I have, but I know that we have a methylated version of the BTT, and I know people that weren't able to take the 2.0 can take the 2.5 without having any type of reactions.
Yeah, well, that's why we came out with it.
Yeah. So I'm really excited about having that because so many people, I'm amazed at, how people come out of the woodwork with all these different things, and then the product comes out and we're just right there making things available for everybody. I love that.
Well, thank you. I appreciate that compliment. Thank you, Rebecca. Now you have to appreciate that all the whole American longevity, which became Youngevity, started when I was 9 years old. I had autism, anxiety, violence, behavior, all this kind of stuff when I was 4 years old. Over a period of 5 years between age 4 and 9, my mom and dad took me to 20 different doctors. So the last one, when I was 9, was a little grandmotherly type grandma pediatrician by the name of Mary Jane Skeffington from St. Louis. And she took one look at me and looked at the record and said, "Look, we're going to have to institutionalize him." I said, "What does that mean, Mom?" She said, "Well, they're going to put you in a hospital." I said, "Well, how long am I going there?" She said, "Well, maybe for the rest of your life." because 20 different doctors can't figure out what you got. They never heard of it before, never seen it before, and you're going to kill yourself or kill somebody else. You're tripping people and pushing them down and stomping on their face and all this kind of stuff. So you can't be doing that. So you're going to institutionalize you rather than go to jail. So that night, when everybody else was asleep, I'm thinking, I don't want to go to an institution for the rest of my life. I'm saying, okay, I'm eating what everybody else is eating, but why am I having all this problem? I'm saying our animals in the garden, they're eating, we're going to kill them and eat them in a couple of months, and they're eating everything we're eating out of the garden. Now, wait a minute. We're giving them alfalfa pellets with all these vitamins and minerals in it. So the next morning I threw my Cheerios out to the chickens. They ran up and chomped down on those Cheerios. And I put the alfalfa pellets, all the vitamins and minerals in my cereal bowl, put milk with it. And that's what I had for breakfast from then on, was these alfalfa pellets of vitamins and minerals. Well, in 3 days' time, after 5 years of getting worse and worse and worse, 20 doctors couldn't figure it out, I was cured in just 3 days. Well, that told me that they didn't know what they were talking about, okay? That who are these people call themselves doctors? I'm only 9 years old. So I began to, and going to church, I never said anything to anybody. And after a couple of weeks, people were whispering and pointing to me because I wasn't disrupting the services. I'm singing within the hymnal and all this kind of stuff. And I'm just a regular member of the church at that point. And I'm only 9 years old. And so finally, after a couple of months, this little old lady came up to me, and this was the bottom line. She says, I hear you can cure my diabetes. I said, ma'am, I'm only 9 years old. I don't even know what diabetes is. So I went back home and I looked in the reference books, because you live on the farm, you don't get the doctors all the time. So you have little reference books for animal diseases and for human diseases. And so I looked at them both, and it turns out that diabetes is a simple nutritional deficiency disease. It wasn't genetic. And so you didn't need to take all these injectable things for diabetes. So I looked it up and began, and I started, every time anybody asked me a question, I'll look it up, I'll have an answer tomorrow, kind of thing. And so I began to put products together and whatnot. But that's why when I graduated high school in 1958, I went to agricultural school, got my degree in agriculture, got my degree in veterinary medicine, got my degree in pathology, got my degree as a naturopathic physician. And I treat people all over the world. I see 2 million patients a day now all over the world through your eyes and other people's eyes, and they feed me back. And so we have a tremendous amount of information. And of course, you've got the website to get my books and CDs and DVDs. I urge people to get them because they will add 25 years to your life. They will 25 to 50 years to your life. I will pay the shipping if you get on auto ship for the products. And you can help your family, you can help your neighbors, you can help your workmates, and your longevity business, whether you're a customer or an associate, a business builder, either one, you get you're getting the wholesale prices. I will pay the shipping if you get an auto ship. And if you sign up as an associate first time, and also when you renew every year, I will give you each time $500 free, $500 free worth of business building materials and information, plus a new free website.
It's incredible, Dr. Wallach. I mean, I've tried other businesses before, and I had to pay a monthly fee for my website just to have it. And here, $50 for the year. I mean, that works out to less than $4 a month for my website. And it's all of the stuff that comes with it. I mean, Longevity handles the inventory. They handle the products that are there available. They maintain the website. They do the accounting. They cut the checks. All I have to do is market and share my story.
Plus, you get tax deductions based on how much square footage in your house you use for your longevity store.
My new computer I write off. My phone I write off. My internet I write off. Do you write off part of your mortgage or your rent based on the square footage of the floor space used? And your longevity business is a willable asset. You can leave it to your church, your kids, your family, your dog, whoever you want to leave it to. Yeah, absolutely. And my skincare, my hair products, my clothes, I mean, all of that I'm able to write off.
Woo!
So it's fabulous. I love it, love it, love it. Now we've got let's try to get at least one more hand, and then I have one more message that's come in this past week. So Monica is 56 and a half years old. She's 125 pounds. She has a brain tumor. She has seizures, anemia, allergies, menopause with hot flashes, sweats. She had a partial hysterectomy. And 18 months ago, she was put on kidney dialysis, and they're telling her it's because she has high blood pressure. Dr. Wallach,
Okay.
this is a beautiful, beautiful lady, just the sweetest, kindest heart, very giving. And
Okay,
I
she's
want to
100,
know,
125 pounds. She's 56 years old, right?
correct.
Okay, she's got osteoporosis. Okay. She's got some blockages in her arteries, which is causing the kidney issues and blood pressure issues. And then she's got seizures. She's got stuff going on in her brain, obviously. So here we go. 125 pounds, 128 pounds, whatever it is. I want her to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat bran, no sugar. 125 pounds, I want her to get one healthy brain and heart pack per month. I want her to get another bottle of our selenium, not Walgreens selenium, because we need the cofactors. I want her to take 3 of our selenium at breakfast and 3 at dinner time. I also want her to get our Ultimate Daily Classic tablets. She can get 2 bottles a month of that, so I can take 3 twice a day. I want her to get our Zerafem, so she can take 3 of those twice a day. She needs 2 bottles a month. The Zerafem, that'll support the making of estrogen, even if they removed all of or portion of her ovaries. There's other portions of her body that actually make some estrogen also to help her with some of that stuff. Then I also want her to take our Fucoid Z. I want her to take 3 of those twice a day. That algae and seaweed has these trace minerals in it that support the immune system, okay, but also are anti-inflammatory. And then I also want her to eat 3 eggs twice a day with soft yolks. Hard-boiled eggs won't count. Fried eggs don't count. In fact, they cause cancer. Soft-boiled, soft-poached, soft scrambled butter twice a day, 3 of them. I also want her to take our, let's see here. I think I said Ultimate Daily Classic tablets, 3 twice a day. Fucoid Z. Okay, that's a lot. Let's start going there. That covers everything that she complained about.
Yeah,
Yeah.
I think you got it all, Doc.
That covers it all. Okay. And so let's hear from her every couple of weeks. Anytime she goes to the doctor and gets a, kind of an examination, what the doctor says. And her story is going to help a lot of people, because this is middle-aged people getting 5, 6, 8, 10 different diseases. They go to 3 different specialists. They're on all these medications. That's their whole life, is running around between doctors and going to the pharmacy and everything. It's all nutritional deficiencies.
Right. Now, Dr. Wallach, because she's on dialysis, she's on binders of the yin yang, phosphorus binders, potassium binders. What?
Well, let's get her started on this.
Mhm.
And then in a couple of weeks, we'll be able to kind of adjust things and tell her, we don't want her to just cold turkey off and her medications. Okay.
No,
She's
right.
she's got to see improvement in symptoms, and then we can begin to reduce her medications based on the numbers.
Now, should there be a time difference between when she's taking those binders and when she's taking her nutrients?
Well, I want her to take her nutrients with meals. And I don't know what the directions are on the medications she's taken, whether she should take them, in the morning and at night, or she's taking them, I don't know. But she needs to take her supplements with the meals.
All right, perfect. Thank you so much. Next, let's go to Michelle, who has her hand up. Michelle, let's try one more time. Yes, I think we hear you.
Nope,
No.
not working.
Still not hearing you.
She
Sorry,
got to talk
Michelle.
tomorrow. Bye, Michelle. Okay, you say we got something else here?
Bill, let's go to Bill, who has his hand up. Bill, go ahead and unmute yourself.
Is that me? Yeah.
You are on with Dr. Wallach, Bill.
Yes, I'm 83 years old. I'm 5'10", about 178 pounds. I had bypass in 1975 at age 37. I had it again in 1987 where they used the mammary artery. My and I'm on medication for statins for my cholesterol and metoprolol for blood pressure. And my main problem now is that a problem with my bowels and constipation. My blood sugar has been borderline, and the last reading was high, but good. And I had prostate cancer in 2000. Other than that, I'm in good shape.
Okay. 93 years old, did you say?
No, I feel that, but I'm only 83.
Oh, okay. All right. So what I want you to do is get rid of all the bad foods. No fried foods, no processed meats, no oils, no glutens. There are no gluten-free oats. The gluten in oats is called gliadin. No gluten, no sugar, no wheat, rye, or oats. And then at 178 pounds, I want you to have 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, the full dose, everything twice a day. I want you to get 3 bottles a month of our Ultimate Daily Classic tablets. Take 3 with breakfast, 3 with lunch, 3 with dinner. That'll support healthy blood flow through blocked arteries into your heart, your brain, your kidneys, and also support healthy blood pressure. I also want you to take the, let's see here, the Synaptive. Take 3 of those twice a day. That's going to support the brain function. I want you to also take the Fucoid Z. I want you to take 3 of those twice a day. That's going to support your bone marrow so you can make antibodies to protect you against the bug. You're 83 years old. You're, once you're a senior like that, you're in trouble if you get the COVID thing. So we don't want you to do that with all these pre-existing conditions you've had. And then the prostate thing, I want you to take our ultimate, let's see here. Let's go another direction here. Let's take the BTT 2.0 tablets, the BTT 2.0 tablets. They do not replace, they are not an exchange for the BTT 2.0 powder, which is vitamins and minerals. The BTT 2.0 tablets are an anti-inflammatory, but also they support the immune system. I want you to take 3 of those twice a day. I do that just for prevention, but because you have a history of prostate cancer, I want you to do that. It'll also help you quiet down the arteries in your kidneys and your heart and so on. And so pre-diabetes, I want you to take 3 of the Sweeties capsules twice a day. That's 2 bottles a month. And, you can get the test strips for urine. You can get the test strips for your, prick your finger with one of those little blade things and get a drop of blood. You don't even need to be able to read. They color code stuff on the label of these test strips, and they only cost $1.50 each. You don't need to spend $100 for an office visit. You don't need to spend $200 for the lab, and you don't need to sit there for a half hour in the waiting room with everybody coughing and belching and burping all over you with the COVID. And so everything you have here is either directly or indirectly related to a nutritional deficiency. And so by getting on the diet, getting on these supplements, and doing this faithfully, all of these things have the power to go away.
Well, thank you very much.
Okay, yeah, keep in touch with us every couple of weeks. A lot of people have the same scenario you have, Bill, and they will appreciate your story, and your story, your testimony will help a lot of people.
Well, thank you very much, Doc.
Okay, God bless you, Bill.
Thank you, you too.
Thank you.
All right, everybody, I can't believe that 2 hours are up already. This is Ask Doc Live. And again, it has been my pleasure to be able to host this program with Dr. Wallach and bring him to you as you are looking for your journey to optimal health. And it's possible, folks. It's not too late. So Dr. Wallach.
Yes.
Thank you so much for being here with us.
Okay, well, thank you, Rebecca. Thank you, John T. And thank you, your whole team. You got Nasima, you got Ruth Ellen, you got all these other people out there. Thank you for the whole team.
Yes, we have an amazing team, and we will be here every Friday to bring this program to you, the Ask Doc Live program. Again, don't forget to get back with the person that invited you to this program.
We'll be here for the next 300 years, Rebecca.
300, let's go, Doc. I'm ready. I'm ready. I don't know if the world's ready for us. We better hurry up and get busy, right?
We're like the Marines. We're the few, the proud, the brave. Everybody doesn't believe, but they're the ones who die early.
That's right. That's right. So what we do is we plant seeds. We water those seeds. And eventually the seeds die, or they come to their senses and start getting knowledgeable about what they can do that doesn't include chemicals.
Thank you, dear.
All right,
Bye-bye.
everybody.
Bye-bye.
have a fabulous weekend, and we will see you next Friday. Again, thank you to my co-hosts, Ruth Ellen and Nasima and Jonty, who makes this possible. And the replays, he is fabulous about getting those up on the AskDocLive.com website for you to be able to use and enjoy and share for everybody you know. Take care, everybody. Bye for now. And please go forth and have a better by the minute life. We'll talk to you later.
Okay, bye-bye.
Bye.